The President of Kenya, Uhuru Kenyatta, is visiting London this week, saw the Prime Minister yesterday, and he's told Sky News that developed countries are still not doing enough to help vaccinate the people of Africa against COVID-19. That is in spite of the UK promising just this week to send his country 817,000 doses of vaccine. He's in London to co-host a summit on global education alongside the Prime Minister Boris Johnson and spoke to Sky's Kimberly Leonard. She began by asking whether the UK has the moral authority to be asking others to fund foreign aid.
Without a doubt, the stoppage has left a gap. Now, if we're going to say we're going to look at different types of partnerships that will fill this gap, I think there was need then to have some kind of precaution so that we don't have this gap in between one model as opposed to another. And this is something that we're continuing to discuss with the British government. This is something we are continually saying, look, we want to partner with you. We want to engage on a different model that also allows greater self-sufficiency and helps create that deepened self-sufficiency. But, you know, it's that transition period that we all need to be quite careful about.
Another criticism is that they just haven't been transparent in the aid cuts, that they've said, listen, we're cutting the percentage, but they haven't been telling these aid agencies, you know, exactly how much they're going to cut their funding by. I mean, have you had any word on how much funding is going to be cut to Kenya as a whole?
We're not 100% sure what that is, but we can say that certain specific programs have already been affected. Some health programs that we've been working on together have been affected. Some education programs that we've been working on have also equally been affected. And that's why I'm saying we are looking towards continually engaging them and saying, look, we and not just we, it's everybody who has been a beneficiary of that assistance. You know, we need to go through this transition as we looking for new models of how we are going to be working together going into the future.
Let's talk about COVID. It's been obviously a very difficult 18 months. Specifically, let's start with vaccines. Obviously, this announcement, 817,000 vaccines being sent. Reuters gave these figures. They said during the last week reported, Kenya averaged about 7,306 doses administered each day. At that rate, it'll take a further 1,440 days to administer enough doses for another 10% of the population. How does that make you feel when the head of your vaccine task force says, we have the money to buy the vaccines, but we can't get them because they've been reserved by the rich nations?
We and I've been very clear on this. One of the things that really has shown how unequal this world is has been the kind of vaccine nationalism that we have seen, where we have, and I've stated this openly and severally, worked together, you know, when they were doing clinical trials, when they were doing the research into some of these vaccines. And then all of a sudden, we find ourselves unable to access those same vaccines. And this is not just Kenya, it is basically the entire developing world. And I think this is something that really needs to be looked at, because the fact of the matter is nobody, not here in the UK, not in the United States, not in Germany, nobody's going to be safe until everybody's safe. And we need to be able to come up with a way of ensuring that there is going to be equity in the distribution of these vaccines. And this is something we on the African continent, we in Kenya, are very perturbed about. And that is why we're saying we need to now be able to focus on our own production facilities.
They won't give you the IP though.
You can't simply say you're not going to remove the intellectual property, but yet at the same time, here we are ready to pay you for the vaccine, and then you say you're not able to deliver.
So is that what you found?
You can't say no to this, and so then what happens? Where do we get these vaccines from? How are we able to protect our populations?
So then what do you say to these nations where you've got, 800,000 odd from the UK, they're pledging that AstraZeneca, right? What do you say to them when they're saying, okay, we're going to give booster jabs to people? We have music festivals when people can walk in and get vaccines, and yet in your own country you have health workers who are unvaccinated.
Not only with the UK, this is a battle we actually have with the entire developing world, where we know there are some countries that have vaccinated well over 40–50% of their adult population, are now vaccinating even teenagers, and on top of that have surpluses, 40–50 million doses, but are still not ready to share that with the rest of the world. That is the height, like I said, of a nationalism that really has to be dealt with. And this is something we are fighting, and we're going to fight day and night until we ensure that there is equity in the provision of these.